The brain tumor diagnosis came 6 months before Sophie's wedding. I was 27 working as a software engineer when the headaches became unbearable. The MRI showed a mass pressing against my frontal lobe, benign but growing, requiring immediate surgery. Dr. Amanda Pierce was one of the top neurosurgeons at Boston General. She explained the risks clearly. Without surgery within 3 months, you'll start experiencing seizures, vision loss, cognitive decline. This isn't optional, Claire. I called my parents that afternoon. Mom answered, her voice bright with wedding planning energy. Claire. Perfect timing. Sophie needs your measurements for the bridesmaid dress. Plum purple, isn't that gorgeous? Mom, I need to tell you something. I have a brain tumor. I need surgery. Silence. Then, a brain tumor? Are you sure the doctor isn't overreacting? You know how these specialists are, they see problems everywhere. Mom, there's a mass on my frontal lobe. Your father's colleague had something similar. Turned out to be nothing. Just stress headaches. Her tone shifted to practical. Look, can this wait until after the wedding? Sophie's been planning for 2 years. She needs you focused, not spiraling about medical drama. Dr. Pierce said I need surgery within 3 months. That's before the wedding. 3 months is just a suggestion, Claire. Doctors are so cautious these days. Push it to after the wedding. 6 months won't make a difference, and Sophie needs her maid of honor. My father got on the line. Your mother's right. We're not having you miss your sister's wedding over some optional procedure. Get a second opinion. Someone less alarmist. The second opinion confirmed everything. The third opinion was even more urgent. The tumor was growing faster than expected. Surgery needed to happen in 8 weeks. I scheduled it for 10 weeks before the wedding. When I told my family, Sophie called me immediately. Claire, you're doing this on purpose. You can't stand that I'm getting married, so you're making up medical emergencies to steal attention. Sophie, I have brain scans. 3 different neurosurgeons. Oh please. You've always been jealous of me. First you couldn't be happy about my engagement, now you're scheduling brain surgery, right during my wedding planning. She laughed bitterly. It's pathetic. Mom called next. Claire, your sister is very upset. The surgery can wait. It's just minor procedures anyway, they go and check things out, you're home the same day. It's a craniotomy, Mom. They're removing part of my skull to access the tumor. I'll be in ICU for days. You're being dramatic. Sophie looked it up. Lots of people have these little brain things removed as outpatients now. The surgery happened on schedule. My friend Rachel from work took a week off to stay with me. My boss sent flowers and told me to take all the time I needed. My parents sent a text. Hope your procedure goes smoothly. Don't forget Sophie's dress fitting is in 2 weeks. The surgery took 7 hours. Dr. Pierce removed the tumor successfully, but the recovery was brutal. I couldn't walk straight for days. The headaches were worse than before. My short-term memory was scrambled. Rachel stayed with me for 2 weeks, helping me shower, making sure I took medications on time, driving me to follow-up appointments. My parents visited once, staying for 30 minutes. You look fine, Mom said, eyeing my shaved head and surgical scars. You'll need a wig for the wedding. We can't have the photos ruined. Mom, I just had brain surgery. And we're very glad it went well. Now about the bachelorette party next month. You're still organizing it, right? I stared at her. I can barely remember what day it is. I'm still recovering. Sophie rolled her eyes. See? This is exactly what I mean. Everything has to be about Claire and her problems. I have one wedding, Claire. But can you please just be supportive for once? They left before my post-op nurse arrived. The bachelorette party happened without me. Sophie posted photos on Instagram. Best night with my real friends who actually showed up. The bridesmaid dress fittings happened without me. Mom texted, we estimated your size. You need to lose the medication weight before the wedding. I was 8 weeks post-op, still experiencing dizzy spells and memory issues, when Sophie called with her final demand. The rehearsal dinner is the night before the wedding. You're giving a toast about how wonderful my relationship with Marcus is. Mom's writing it for you so you don't mess it up with your medical drama. Sophie, I'm still recovering. My speech is affected. Excuses, excuses. You're fine, Claire. The surgery was weeks ago. Stop milking it. Dr. Pierce saw me for a 3-month follow-up 2 weeks before the wedding. You're healing well, but you're pushing too hard. Your brain needs rest. Are you getting adequate support at home? I told her everything. The dismissals, the minor procedures comments, being called dramatic and attention-seeking for having brain surgery. Dr. Pierce's expression hardened. Your family works in healthcare? My dad's a hospital administrator at Boston General. Mom's on the hospital foundation board. Your father is Michael Chin? I report to him. She paused. Claire, the hospital foundation gala is the same night as your sister's wedding rehearsal dinner. I know. Dad's giving a speech about hospital excellence. Something shifted in Dr. Pierce's face. I'm receiving an award that night. For surgical innovation. She looked at me carefully. Would you like me to share what real neurosurgical recovery looks like? What minor procedures actually entails? I didn't understand then. I just nodded. The wedding week arrived. I was still weak, still experiencing headaches, still struggling with the cognitive effects. But I showed up to every event in my wig, smiling through the pain. The rehearsal dinner was at an elegant hotel ballroom. Sophie glowed in white, Marcus beside her, both sets of parents beaming. I sat at the family table in my ill-fitting bridesmaid dress, trying to remember the toast Mom had written. Sophie's maid of honor went first, gushing about their friendship. Then Sophie grabbed the microphone. I want to thank my amazing family for making this wedding perfect. He gestured to our parents, especially my mom and dad who supported me through everything. And my sister Claire, who finally stopped making everything about her long enough to be here tonight. Laughter rippled through the room. Claire had some minor medical procedures a few months ago and acted like the world was ending. But she's fine now. Just proves that half of medical stuff is just drama, right? More laughter. I felt my face burn. Anyway, Claire was supposed to give a speech, but honestly, we all know she'll just talk about her surgery. Sophie rolled her eyes. So let's skip that and get to the good stuff. The room applauded. I sat frozen, humiliation washing over me. Then I saw her. Dr. Amanda Pierce, standing near the back of the room in an elegant black gown. She wasn't supposed to be here. This wasn't the hospital gala. That was across town. She caught my eye and smiled. Then she walked toward the front. Sophie was mid-toast, talking about how perfect her life was, when Dr. Pierce reached the microphone area. Marcus's father, a cardiologist, recognized her immediately and stood. Dr. Pierce? What an honor. Everyone, this is Dr. Amanda Pierce, one of the finest neurosurgeons in the country. The room quieted. Sophie looked confused. Dr. Pierce smiled warmly at the crowd. Forgive the interruption. I'm actually here because I just came from the Hospital Foundation Gala across town, where I received the Surgical Excellence Award. She paused. Michael Chin presented it, actually. Your father, Sophie. My father's face went pale. During my acceptance speech, I mentioned a case that exemplified the challenges we face in neurosurgery. A 27-year-old patient with a frontal lobe tumor. 7-hour craniotomy. Significant postoperative complications. Dr. Pierce's voice filled the room. The patient's family called it minor procedures and optional surgery. They suggested she was being dramatic. They told her to postpone life-saving brain surgery for a wedding. Sophie's smile froze. I didn't name the patient then. But I'm going to now. Dr. Pierce looked directly at me. Claire Chin is one of the bravest patients I've ever treated. She underwent major brain surgery, experienced significant cognitive and physical complications, and recovered with virtually no family support. While her family dismissed her tumor as drama and attention-seeking. The ballroom was silent. A craniotomy isn't a minor procedure. It's one of the most complex surgeries in medicine. Recovery takes months, sometimes years. Memory issues, speech difficulties, chronic pain, these aren't exaggerations. They're medical reality. Dr. Pierce's voice hardened. To minimize that, to call it optional, to suggest a patient is being dramatic about brain surgery, that's not just cruel. For healthcare professionals, it's unconscionable. My father stood. Dr. Pierce, this isn't appropriate. What's not appropriate, Michael, Dr. Pierce said, is a hospital administrator who didn't take his own daughter's brain surgery seriously. And a foundation board member who told her daughter to postpone tumor removal for a party. She held up her phone. At the gala tonight, you said families must trust medical expertise. You said, We must never minimize what our patients face. She let the silence sit. Meanwhile, she continued, your daughter, who had part of her skull removed, who had seizures, who is still recovering, was called dramatic. Told her surgery was optional. Forced to plan bachelorette events while struggling to think clearly. Sophie started crying. Marcus looked stunned. Guests stared in disbelief. The hospital board met tonight, Dr. Pierce said. They are reviewing whether your personal bias affects your professional judgment. Mom stood up crying. This is a misunderstanding. It's not, Dr. Pierce said. It's documented neglect. I have notes from every appointment where Claire mentioned your dismissal. Records showing coworkers, not family, took her to follow-ups. Medical proof of complications made worse because she had no support. Dr. Pierce faced the room. I'm here because Claire deserves witnesses. Her father gave a speech about patient care hours after ignoring his own daughter's medical emergency. She walked to my table, placing a hand on my shoulder. You did everything right, Claire. You listened to doctors. You fought for your health alone. You survived the tumor and the cruelty. Whispers exploded across the room. Marcus's father pulled my dad aside, furious. Sophie grabbed my arm. You planned this. You ruined my wedding. I didn't know she was coming, I said. But I'm glad she did. You're selfish. I wanted one perfect day. Dr. Pierce stepped in. Your sister had brain surgery, Sophie. While you were picking centerpieces, she was learning to walk again. While you picked fonts, she was having seizures. She just needed basic compassion. Marcus asked softly, Sophie, did you really call it minor? She was fine. Sophie protested. The doctors exaggerated. Dr. Pierce is one of the top neurosurgeons in the country, Marcus said. If she says it was serious, then it was serious. I stood up. I'm going home. You can't leave. Sophie hissed. You're my maid of honor. No, I said. I'm done. Rachel grabbed her keys. Dr. Pierce walked me out so no one could stop me. Outside, she said, the board meets at 9 tomorrow. Your father will be questioned. Your mother's role will be reviewed. Thank you, I whispered. Always, she said. The board review happened. Dad was put on leave. Mom was removed from the foundation board. The wedding continued without me. Sophie sent a cruel email. My parents sent a lawyer's letter demanding I retract lies. Dr. Pierce replied with 30 pages of medical evidence. 2 weeks later, Marcus canceled the wedding. I can't marry into a family that treats medical emergencies like inconveniences, he said. Sophie blamed me. My parents blamed me. Families split apart. Most took their side because the truth sounded too awful. But doctors who attended the rehearsal messaged me with support. 6 months post-surgery, I returned to work. I was promoted. Rachel moved in with me. Dr. Pierce asked me to speak at a conference about patient advocacy. My parents tried to contact me through my grandmother. They want to reconcile, she said. But they only learned their lesson after public humiliation, not because they cared. 1 year post-surgery, I celebrated my clean scans with Rachel, coworkers, and Dr. Pierce. We toasted survival and found family. Then my phone buzzed with a text from an unknown number. I'm sorry, Sophie. I deleted it. Because sorry doesn't erase being called dramatic for having brain surgery. Sorry doesn't give me back the months I spent recovering alone. Sorry doesn't undo a family that chose a wedding over their daughter's life. 2 years later, I'm thriving. The cognitive issues have mostly resolved. The scars have faded. And I've learned that some families will never see your worth. But that doesn't mean you're worthless. It just means they're blind. And you're better off without